Hi, it's Karen Damshin with Damshin Financial Planning. Today we're going to talk about something that affects all of us, and that is dental. So, our dental insurance, how we're kind of covered for our oral health. So, I recently read an article by the CareQuest Institute, which kind of sparked the idea for this week's video. So, today in the United States, about 27% of adults do not have dental insurance. And we know that there are a lot of factors that can lead to poor health outcomes throughout life. And one of those really important factors is our oral health. So of those uninsured adults, about 12% of them lost coverage within the last year. And what that's kind of telling us is dental coverage is likely getting more and more expensive. For those of you who have dental plans, you've definitely seen this. So those adults ages 18 to 29 or 60 and older are most likely to lack dental coverage as compared to kind of middle-aged adults. So I think this is something important to pay attention to. And it's a question that I get quite often, and that is, how do I get dental insurance? For those of you who have individual health insurance, or even if you're on Medicare, dental coverage, that kind of basic dental care, is not covered at all. So, but you can seek dental coverage from private insurers. And we have a number of options here that offer dental insurance and offer different kinds of dental insurance. Now, some important things to understand. You can enroll in dental coverage anytime during the year. Most dental coverage outside of an employer plan or like the marketplace allows you to enroll at any time during the year into a dental plan. And we have a couple of different types of dental plans. There are kind of those traditional dental plans, which maybe you have a deductible and you have some coinsurance and you have some copays. And then the dental plan is going to cover so many dollars worth of dental coverage in the calendar year. And then you're responsible for everything above and beyond that. That's kind of a traditional dental plan. There are also some dental plans out there that are more like discount dental plans. We did lose a big carrier in Arizona this year, Employers Dental Service, which was a principal dental plan, did leave the market. So, and it was a very inexpensive dental plan. And they kind of told you, if you go see a dentist and you need a filling, here's how much a filling would cost, or a crown, or whatever the service may be. So they did exit the market. We do have a couple of other options that are similar to that. But that was kind of a big blow to especially individual dental in Arizona. But some things to understand with dental plans, there can be waiting periods. So you might enroll in a dental plan that says, well, we'll cover a couple of cleanings this year. But maybe in the first 6 months, 9 months, 12 months, they may not cover some of the more expensive dental procedures like root canals, crowns, bridges, implants, those types of things. And speaking of implants, not all dental plans will cover implants. So if implants are an important coverage for you, you want to dig in and make sure that you have that coverage. And then often dental plans allow you to add a vision plan kind of as part of your package. Individual vision coverage can get pricey. You might pay $15, $20, $30 a month to have a vision plan that's going to cover an exam and maybe a pair of glasses. So kind of deciding if that makes sense for you to add it. Sometimes when you add it to a dental plan, it can be a little less expensive. So anyone can enroll in dental coverage. Obviously, if you have an urgent need today for some sort of dental coverage, we may have a waiting period. So we want to take a look at what those options are and pick which one kind of fits your needs the very best. Of course, if you have questions, if you'd like to schedule an appointment to review dental options, please make sure you reach out.